And here is, of all people, Rick Scott coming out there and basically saying like, hey, if you don't want to work on Medicaid, you don't deserve to get Medicaid. First of all, this guy had to plead the fifth. I think it was, I'm not sure how many times it was. Was it 50 times or was it 40 times?
For sure it was a record, whatever it was.
Because his company was involved in Medicare fraud. Medicare fraud. Now, again, to be clear, we have seen two examples of two different states, Arkansas and Georgia, that have imposed work requirements on Medicaid. Disasters, both of them. Listen to this.
Of course, one of the sticking points is this business about paying able-bodied 30-year-old men without dependents welfare with no work requirement. Why do some of your colleagues have a problem with that?
It doesn't make sense to me. Number one is if you don't want to work, you're the one that decided you don't want health care.
Right.
That's number one. Number two, Medicaid is supposed to be for children that don't have health care and people with chronic illness. I remember when my brother couldn't get health care.
Pause it. Hold on. Wait a second. And it turns out it was 75. Fifth Amendment took the fifth 75 times. Medicaid is not for chronically ill and children only. Medicaid is also for low-income people, specifically, explicitly.
Half the births in rural America covered by Medicaid.
And the moralism that's involved in here, I got news for you. That 35-year-old you may think is a slacker and a real scallywag for not working and wanting to get Medicaid. But if that scallywag gets sick, guess what? You're going to pay for that scallywag anyways, because they're going to go to the emergency room and all of our insurance rates are going to go up. And you're also going to be shutting down community hospitals around the country who are not getting payments for even the non-scallywags.
There was a study that was done in 2022, I guess it was or 2023 by the Urban Institute, that showed that 53% of adults sleeping in homeless shelter, 40% of people sleeping on the street were employed during the same year that they experienced homelessness. So just to give people like the working poor is the reality in this country.
Ironically, this is a good point made in the abundance book, which is that it's not things like mental health or like not wanting to work. It's the cost of housing that makes homelessness.
And then it's quite difficult if you're homeless, also because you've lost a home base, you may not have an address to get a job when that happens. So it's a spiral of poverty that he's, of course, blaming on the individual. Rick Scott is the most Republican I can think of.
Continue.
That's number one. Number two, Medicaid is supposed to be for children that don't have health care and people with chronic illness. I remember when my brother couldn't get health care, I grew up in public housing. Today, that child might not get it because of what these states are doing. They get more money to take care of able-bodied adults.
So are you...
Wait, what is he saying? Well, I have an idea. How about expanding Medicaid? How about expanding Medicaid if that's really your concern? Of course it's not. Of course it's not.
I mean, why is he pitting CHIP against Medicaid? That's what he's talking about, right? There's 8 million kids on CHIP by my last count, 70 plus million people on Medicaid. And
here is Steve Scalise saying the same thing about Medicaid and trying to make it about
laziness.
Laziness. I guess the number of 34-year-olds in the basement playing video games. We have got 10 to 13 million of these people apparently on Medicaid right now because that's who they're kicking off. That's a lot of people sitting in the basement playing video games. Go ahead.
But we do put some constraints in place in terms of work requirements and say, if somebody's able-bodied and they can go get a job and they're living in their mom's basement playing video games, I'm sorry, you got to go get a job. This program was designed for the truly needy, the disabled people, pregnant women, seniors. Those are the people we're going to help more by shoring the program up. And so why would you want a runaway program that's going bust right now, which is what we have? Let's get the program back on track. And we do that. But clearly there were a lot of discussions along the way. Some of us that would like to go further. But this is where we are in the bill. But the work requirements are going to be significant reforms to get people back in the workforce. And I think ultimately that's a good thing, to take somebody who's fully able to work to get back to work. But
yeah, and this also will put them into the Affordable Care Act exchange. So that means that they have to go to the private insurer. The Affordable Care Act, the patient protection part had some success, and uninsured rates have gone down as a result of it. But the Medicaid expansion was a big part of that too. So that's what they're trying to push: more private health insurers getting money.
It was Steve Scalise, aka, according to himself, David Duke without the baggage, talking about how lazy people are.
Yeah, KFF Kaiser has the stats on this. 44% of Medicaid adults are working full time. 20.
Then you have another 20% that are working part time. So 64% of Medicaid recipients who are ages 19 to 64, because there's a ton of kids on Medicaid. 64% are working.
This graph I sent we can
pop up this graph.
This up. Yeah.
I'm sorry, I thought we had that up already. And then those not working, 12% not working due to caregiving, because of course we don't have any way in which to pay for care for people's parents. Another 10% are not working due to illness or disability, but who knows if that crosses the threshold of what constitutes disability, because the disability requirements in this country are extremely difficult to meet. Then you have 7% who are going to school. We had that story that we read yesterday. I think it was about a nurse going to get another degree, also dealing with cancer treatments. They would be not eligible for Medicaid under these requirements. And then there's another 8% who are either not working due to retirement. How dare they? They retired early. Inability to find work or other reason. So the worst case scenario is that 8% of them all are just morally despicable.
Playing video games.
And playing video games.
In their grandma's
have
basement.
no reason, and they're just basically walking around enjoying life without any income, but knowing that they have Medicaid. Like
Not serving a single capitalist.
Exactly. Like walking around, living large.
Not making money for anybody else.
Right.
I wonder what percentage of that is literally like, people who have inherited money and are just like,
Yeah.
there's probably some people like that.
But it's probably it's probably a significant portion of those people are just like retired before 65. That is my assessment. That would be my guess.
And I got news for you. If you are working, if you are, many people work and it just takes such a toll on their body that by the time age 55, they simply can't make it to Social Security time. Others may have been looking for work and given up looking because they had been, it's very hard to find a job. You get fired at age 58 or 60. Hard to find a job in your 60s.
Yep.
So that's where we're at. Now, the interesting thing about this, too, is that after all this, hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.